Russ Gilliam,
Right here. Russ Gilliam.
David Lieb,
Yeah.
Robert Sossman,
Present.
Grace Lauder,
Here.
Carrie Crawford,
Here.
Amy Sadler,
Here.
and I'm Michael Mayhorter. So we have the approval of the minutes. Is there any discussion, corrections, or motion?
I'll make a motion to approve.
Okay.
Second.
We have a first and a second. Any other discussion? All in favor, say aye.
Aye.
All opposed? Motion passed. Any old business? Okay. New business. The budget.
So before you is the budget. This is a preliminary budget because, as you know, the state legislature has not concluded their final hearings yet. So we don't know if HFI money will be available, and we don't know if it is or isn't, whether the commissioners will take that or not. In addition to a decrease in funding already set forth there, they're looking at major restrictions on the use of the money as well. So as of right now, 2025, you have to split the money 60-40 from preventative services to like enforcement services. So like nursing versus septic inspections, food inspections, things like that. They're looking to restrict that to 90-10. So that will make the budget look even different, more different than it is already. But as you see, what you have before you is very similar to last year. We do not have any of the funding amounts for our partners in there because we just don't know what that money will look like. And you see about a $25,000 decrease from last year's budget for all of the health department part to this year. And that is a reduction in capital improvement because we are not purchasing a vehicle like we did this year for Darcy, and a few minor changes to some of the line items in there. But otherwise, about 25% less. So we're well over the 5% decrease that the county commissioners asked for. So if budget stayed as it is today, I believe it would be passed by the council. We just don't know what the final numbers will look like and exactly how much we're getting from the county or from the state if they choose to take the money. Any questions on anything specific in there? It's a pretty lean budget to begin with. We always are pretty lean. There's not a lot of fluff in there. And at the end of the year, usually we're transferring monies between line items to make sure we're never in the red.
I have a general question instead of specific. The state had a significant shortfall on funding. What's that all about? Somebody just bad at math, or what's going on with that? And that affects us and everybody else because of the shortfall.
So I don't know why they can't predict it better. I know that some of it was blamed on tariffs, which I don't see how that could be that fast of a decrease. But I know that here locally, building in the county is slower. It has been for the last 5-6 months. I think there's just some general anxiety among consumers about jobs, about the economy altogether, and they're just waiting to see what happens with that. So again, they're saying $2.4 to $3 billion decrease. They already passed the property tax changes, so all we can expect is to see less coming from the state for county in general, as well as for the health department. We do have our separate levy, as always indicated, but the council does set that percentage every year. Last year they gave us $500,000. We'll see if they do that again this year or not. So.
It's lucky we didn't hire a lot of new people last year.
Yes, I think that even though it was difficult to do all the extra work that we've taken on as staff, I do believe that it was wise not to hire people because other counties are now looking at cutting staffing or otherwise coming up with the money locally to pay for that. I know that, I don't know if you heard about March the 24th, the CDC pulled back $11 billion from all the states. So anybody in Indiana who had hired somebody or paying for a program with COVID-19 money, that got pulled away. It wasn't like you get to finish the year. No, that day it stopped. Turn an invoice, you're done working. And they've had several positions at the state and several departments actually close because they were using that grant money to pay for that. So, yep, they're restructuring and making things more efficient, maybe. So,
We hope. Any other questions on the budget? Okay.
yes,
Any other new business?
if you want to pass it as is with expected changes, we can either call another meeting or I can send everything out over email and you guys vote by email if you wish. Just whatever you'd like to do. I do need to present this May the 14th to the council and then we have a meeting in June.
Okay. How does the board feel about that? Does anyone want to make a motion to do it now, or do we want to wait and vote it?
You can do it again in July at the July meeting. It's already been presented to the council at that time, but I think you should at least review any changes by email and then you can decide at that time.
That sounds good to me. Anybody else have?
I agree with
I
that.
agree, yeah.
Okay, we'll do that.
I'll make a motion that we accept it as it's presented, and then we, currently, and then we go ahead and get an email from Scott with any changes. And then we vote on that budget as well.
Second.
Okay. Everybody in favor, say aye.
All right.
Aye.
All opposed? Okay, that will be carried. Okay. Any other new business?
No, when you go to with staff and Dr. Burkett give their report, if they could include a little bit because the audience does not know what they gave as a report. So if they could say a little bit about your report, that'd be helpful for the audience possibly viewing online.
Okay. Well, we'll go to the reports then and start with Dr. Burkett.
Darcy and I had an opportunity to go to a conference sponsored by the Indiana Department of Health yesterday down in Carmel. And as I mentioned, Dr. Weaver spoke, and she had been in the governor's office that morning talking about the budget. And she said it seemed hopeful that it would still be on target for around the $100 million range for the HFI funding. Last year was $150 million, so it would still be cutting things across the board. But they were hoping that that would be finalized working in the business today. She said sometimes that goes well into the night before they adjourn, sign and die. There were several reports from different counties of things that they had done with the HFI money, different programs that they had gone into, and all of them obviously were a little nervous about whether or not they'd be able to continue these programs. All sounded great, but they'd hired staffing and coordinated with other agencies and so forth, and whether that was going to continue or not, they were all kind of holding their breath, which makes sense. Beyond that, I did get a chance to talk to Dr. Gutwein, the health commissioner in Allen County, about the measles outbreak, which I'm sure you've seen in the news. And as far as we know, there's 8 cases, all in the same cluster, all related. Not sure where that takes us since a couple were just identified last week. Probably all exposed about the same time, but they had onset of symptoms at different times. So we're still going to be in the 21-day window for probably another couple of weeks, it sounded like. Nobody has been severely ill, fortunately. Don't seem to have anybody outside of that cluster, but all of a sudden measles is the top topic in the state of Indiana health department. Otherwise, the viral season seems to be coming to an end, hopefully. Everything's kind of winding down. cases of COVID and influenza and all that have cut back down dramatically, which is a good thing. That's all I have, unless you have some questions.
Anybody? Okay, well, thank you very much. Go to Heather.
So like Scott said, at the state level, the funding cuts, my investigations, the state was assisting with some of them. One of them was animal bites, so now I will be taking that back. Campylobacter, salmonella, other investigations like that, they will be putting back on us at the local level. It was nice that they were assisting, so hopefully in the future they will help again on that. We do have a Class B arrival from Thailand in Whitley County, so I will be working with that person to make sure that they follow the rules to be in the United States, which is they have to have a blood test and a chest x-ray to make sure that they don't have tuberculosis. Blood levels are about the same, pretty high, I believe. With the blood levels 3.5 to 4.9, we have 19 kids that we're monitoring. And then 5.0 and higher, we only have 4 kids that Scott and I are monitoring together, because he has to go to the home when they're 5.0 and higher. We did have 2 more people pass away in the county related to COVID this quarter, so that brings the total since COVID came about to 97 people passing away in our county from COVID. That's all I have.
Question, are you going to talk some more about fine from Charbusco?
The what?
The lady that was killed on the snowmobile. And discuss that more. You said you'd mentioned that.
Oh, I have a meeting today for child fatality. So the child fatality team gets together and we discuss how maybe things could have been prevented. And then that will go to the state as well.
So you're just doing a review right now.
Right,
Yeah.
it's required by the state.
Yeah. I knew her, and that was really sad. Amazing person from Germany, exchange student, and she wanted to be a surgeon.
How old was she?
17. Very interested about history. I gave her a whole bunch of stuff on history and the development of northeastern Indiana and Charbusco, this whole area. It was just devastating. That's it. Okay, sorry.
Any other questions for Heather? Thanks, Heather. Traci.
I've been busy with a lot of new places opening up, and then I'm getting ready for the first practice coming up next Friday. The new food code went into effect April the 16th. So I've been educating people as I do the inspections on the new changes for that. And that's all I have.
Any questions with that? Okay, thank you. And we'll go to April.
As Dr. Burkett said, 2 new legal cases that were related to the others. The child that is new was unvaccinated. The adult is unknown status. I've done probably about 15 kids that have been unvaccinated since this all started, but not a lot. There's been more concern in adults than kids. Travel has been busy. There's been lots of yellow fever, typhoid. People are traveling like crazy. Friday, go do CPR instructor training, so we can teach CPR classes here at the health department. I did a car seat check a couple weeks ago. COVID vaccines, we haven't done any of those for, 6 weeks or longer. We have a school clinic at Busco. About a month ago, we did 8 kids, and we'll go back next month to try to catch some more. It all relies on parents getting those forms back. So, other than that,
discussion? Thanks.
I'm
Go
sorry.
ahead.
How is your supply on MMR vaccines?
It's good. I don't have a ton, but it's, all I have to do is ask the state for it and they'll overnight it, so.
Thank you. Scott?
Been very busy, unfortunately, with Department of Child Services and dirty houses, and the last 3.5 weeks have been a lot. I have gone probably to 5-6 different houses. They've all been unsuitable for children, so until they get things cleaned up. I think one of the families were evicted because they were meeting what the landowner wanted. I went to court yesterday on one of the cases. I go to court next week on another case. So not a lot of productivity for me getting out and doing inspections. It's been wet and everything, but a lot of work with child services and dirty homes and children's needs not being met and children being reported for lice and flea bites, and very sad state of affairs. For some reason, this spring has been really bad for that. Otherwise, just monitoring, going to state meetings, trying to decide on what we're going to do with the budget, things like that. So otherwise, I think the department's going well. Things are getting done. It's just my part's been more depressing. Any questions for me at all? If you ever want to see one of these houses, let me know. I got pictures.
How do you get alerted to those homes?
Well, usually, so like in one case, the preschool called, DCS because the child had been there a couple times with head lice, was being treated, was being held back at home till it was treated. And they're like, we're not going to let her come here anymore. And so then DCS gets involved, because with DCS, you can file an anonymous complaint through their 1-800 number. For my department, you got to have a written complaint if somebody from the county wants to do that. If it's a partner like the police or DCS or highway department, they can just verbally do that for me since they're a department. But then I get called into that to make that decision on whether it's habitable or not. My attorney for the county health department feels like they can do that too. They don't really need me, but I think they like to have that second opinion. Some things that I look at when I go into a home is, one, they have to have running water, a running water source. So even Amish have running water. It might be carried into the home, but they have to have running water. They have to have proper waste disposal. They have to have a working toilet if they're on sanitary or septic system. They have to have a central heating element, so a wood-burning stove or a fireplace that's been certified or installed correctly, or a working furnace. They can't use space heaters or kerosene heaters to heat the home. Then beyond those three basic things, you can't have any rodent infestation, any insect infestation. You can't be having animal feces on the floor. You'd be surprised at how many houses have that. With children who are under the age of 3, hand-to-mouth type of situation, crawling on the floor, where you're seeing that possible transmission of the disease. Again, most of these homes have quite a few animals that people just can't handle. They can't, afford for the vet correctly to be monitored, but let alone food, kitty litter. They have too many. And it's difficult for me to get them to reduce that number because they're attached emotionally. Sometimes there's been in the past the children are taken and the animals are left because that's what the parents decided. They knew that the children would be cared for in the foster care system, so they were okay with letting their children go. But yes, a variety of ways, but mostly through DCS or the police. The one in Busco, police called me and said, hey, we were in this house. There's a 16-year-old living there with 6 other adults, and it was very, very bad. Basically, I'm like, you got a lot of ways to go to get this to even be suitable at all. So it is sad that happens. I think there's a psychological disconnect on some of these cases where maybe some mental health counseling would help with people, some services about how to clean and what's appropriate and how many times a week, and when you're done with your foodstuffs, what do you do with it? You just don't set it on the floor for the animals to eat. It's craziness sometimes.
Any other questions for Scott? Thanks, Scott.
Sure.
On to Danielle.
The first couple months of the quarter, I was pretty busy with patient visits. The last month or so, it's been a little slower. Still getting most of my referrals from nutrition, haircut here in town. Day classes are on hold, they're moving. So I'm just working in my extra time on developing more classes so that those will be ready when it's time to start again. If you have any ideas for families, new moms, babies, young families, give them to me because I'm kind of starting to run out of some ideas. So, we've had more human milk donations, so we're getting close to the 10,000 ounces number, which is pretty exciting. So, no recent orders of the milk that we can dispense, but we do get calls still about it. I attended the Healthier Moms and Babies Symposium with Darcy in Fort Wayne in March, and that was really good. I felt it was super valuable and always a good opportunity to network with other providers too. And then Darcy and I talked to Columbia City High School's freshman students about career paths, career opportunities. I talked about nutrition and lactation, and then Darcy, of course, talked about nursing. So that is it.
Question, what is the shelf life on the milk that you got?
I think it's 6 months.
And then what do you do with that? Just have to dispose of it?
No, so I will connect with another, usually I'll connect with DuPont Hospital. They also have a depot, so they give that milk out probably daily. So
okay. I
usually just contact them a couple of weeks before it's going to expire and usually take it to them or connect with them.
Any other questions? Thanks, Danielle. Darcy.
So you, excuse me, you guys got my list of things, but I'll just go over them briefly. So I am doing monthly classes with Bay. We have a water safety class scheduled for May. So Bay's gonna help with that even though they're not currently open. And we also meet with our 7 senior groups on a monthly basis. We recently added Kyler Ridge and Cherubusco. And I do programming 1 week and then 2 weeks later, Ashley's there doing programming. And we do offer blood pressure checks at every meeting. Our women's wellness program has been for 3 months now. And excuse me, we did have about 30 women. The first 2 events, we were down to 19 this last event, but with the weather being 80 degrees outside and sunny on Tuesday evening, I'm guessing that was part of it. But Dr. White from Parkview Cardiology spoke. The women really, really enjoyed it. And then he did a little Q&A at the end. He told me he'd speak for 30 minutes, and I think he spoke for 50, 60. So it was a great program. We did put out a survey after that program on Tuesday just to see if women were interested in continuing that for 2026, and they were all absolutely. We have Remedy Live that comes and does polling on their phones, and I think he told me at the end on Tuesday, I think there was a 95% approval rate on the program. So it's well received. And I looked at the surveys a little bit yesterday when we were in Indianapolis, and one woman commented, "I just enjoy the opportunity to spend the evening with other women." And another lady said, "It's my me time." So hopefully, and they also gave suggestions on topics they want for next year. So things that we do not have scheduled for this year. One, that multiple people have asked for self-defense for women. So we'll start looking at those things. In March, I completed the Tobacco Prevention Coalition grant. I have no idea how it will be funded. We requested almost $120,000 for 2 years. so that we can get somebody in here to just focus on that. I don't know if you guys saw in the news, but there was a student at one of the Fort Wayne schools that had a baby that was laced with fentanyl. And the school had to give 2 doses of Narcan to revive him. But we have to focus on that. So I'm hoping we'll know in May whether or not we got that grant. We teamed up with Bowen and did a mini health fair out at Park Terrace. April and Ashley and myself will be doing CPR training tomorrow. We'll be CPR instructors, and I get asked that the most. Can you guys teach CPR? Our little trifold resource guide, Sonia rubric, got that updated for us, and I've taken that to our partners. First Fridays, next Friday's our first Friday, and we purchased through the health department 50 bike helmets for youth, and we have some infant and then up through high school age, and those will be given away for free. My thoughts are, Scott, we don't advertise a lot because I will go through all 50. And then the 4-H Club's gonna help us fit those. And I already had Eric Blanken to take a look at them, and he was just very thrilled that we were doing that. Ashley will be joining and offering American Heart Association heart health information, and then we'll also have blood pressure checks there. And then Ashley did complete Catch My Breath training at South Whitley with all of the 5th and 6th graders. So very grateful that we were able to get in there. And then I did train 3 people out at Indian Springs Middle School on vaping education. So hopefully they'll implement that. So, and then Ashley's been doing other topics out at Try Alternative every week.
It was every week in March, throughout the month of May, because I was supposed to be in Dallas this week. And then I go back in May for 3 weeks.
So, and as things get settled in, I'm just looking to what's the next program we want to get started. So, any questions for me?
So, question on May 10th, question comment. On May 10th in Churubusco, there was suicide awareness walk. Are we doing anything from the health department with that? We had a booth or something last year, I think.
I am probably not going to be able to go this year. I have a Saturday event with Babe on May the 3rd, and I just can't do it all.
Sure. Why not?
So.
Okay, just to let you know, that's worthwhile. They have a lot of good people there, and it's pretty interesting, just the resources and the contacts.
Well, I was there last year.
Yeah, I know
I
you were.
participated last year, but I don't know. We'll see how the next few weeks shake out. But I'm not making any guarantees at this point. So.
Thanks, Darcy. Then we go to Laura.
Okay, so we had one home birth that took place in February. We are in the process of getting the birth record amended with the state. It came through with the child having a last name that did not match the mother's, and there's no father listed. So there's no indication of where that last name came from, so I made the state aware that the record did not seem efficient, so they were going to contact the midwife. So that was a female. It was a home birth. For the deaths, we're high this year. Coroner's been extremely busy. We've had 11 cancer deaths already this year. Lung cancer still seems to be high. Prostate cancer, and then there's just a whole array of other type of cancers. Some of them seem to be leukemia. We're just a whole array. I mean, I see them everything. We had the accidents, the car accidents. We had the motorcycle accidents. So we've had 6 total accidents, and then 1 suicide. And so the state, as of April 1st, has said that all counties can issue other counties' birth certificates. The discussion that's taking place with the state is that the counties are not really in favor of this because the state records are a mess. Just within the last couple of months, I've had 2 different cases where I went into the state system to find a record and could not find it at all. We are dealing with a double adoption for one individual. When he passed, his records were not matching the birth certificate that his informant had, so she's having some trouble closing his estate, and the state didn't have any records, so we're trying to get that taken care of. So there's been a lot of issues with the state. Most of us do not want to issue each other's records. We don't find that to be very effective. And then as of March 4th, there was an executive order by the governor that we are no longer amending gender on birth certificates. That is not taking place. So those are the changes.
Any questions for Laura? Any other business or concerns?
Sure.
Ashley
Go
might
ahead.
have something.
Okay.
Actually,
Anybody else?
Oh, Ashley. Sorry.
I wasn't prepared for that. Just like Darcy said, we've been meeting with the 7 different senior groups and adding in the color range and meeting out in Troy. I've got 2 more classes of Troy before school years up. I went and met with the initial group that meets down at the hospital monthly to try and get into the churches some more. So we're still waiting to hear back from them. We had, back in January, I held a meeting, sent out like 20 emails to all the pastors and churches in Whitley County, and we had 3 show up. But we are trying to get into the churches still to get some information up to them.
and that's been a push by me for some of the programming, because I believe we really need to have that input to make things successful for mental health, addictions issues in Whitley County. You really need to have that element. You look at AA and all their programming, there's always a element of a higher power, a religious element there. I think it really is important for people to have that in there, and it's been very difficult to get buy-in from the churches on that. I understand some of their hesitancy, but that's really, I think, for us to be successful community-wide, we really need to have their input. I think, that some of their charge would be to help those who can't help themselves, and I think that's what we're trying to do, is get them to recognize that these issues are there and not be isolated in that one spot where they might be. So we've been really trying hard to get them involved and all that. And Ashley's done a really great job. She's been out doing much more than any of her other counterparts in other parts of the state. And we're hoping, even with some of the budget cuts at the federal level, that the American Heart Association will continue to keep Ashley in her spot, that she can be not just Whitley County, but maybe even a regional person for everybody. So.
Thank you, Ashley. Anything else?
Yeah, one more brief thing. This pretty interesting. I've got another copy up in the office. These are to be read and looked around, but Robert Kennedy is touching on this right now with getting the adulteration out of the food, the artificial colors and flavors and all. This says it all. I met this author several years ago, talked to him quite a bit, but this is pretty interesting about the Dorito effect on how industries manufacture food to make you want to eat more. It has less nutritional value and a lot of junk in there that you're consuming, and we're responsible for a lot of health issues. But this is really a pretty interesting book. I'm going to leave those right here. Anybody wants to take them, bring them back, and then you can share. But that's pretty good. And then there's another book coming out called An Abundance of Caution on some of the things the federal government does that just make no sense and affect us all. So that should be pretty interesting. That's just coming out. But these are real good, and that's been out for a few years. Gives you a better idea of what's happening in our general food supply, and especially the junk food areas.
I've read it, it's good. I agree.
Okay. Anything else? Well, is there a motion to adjourn the meeting? We should do that now. Is there a second?
Second it.
Okay. All in favor, say aye.
Aye.
All opposed?